Magandang hapon po sa inyong lahat and welcome po to the 10th webinar in our University of the Philippines, the Philippine Health Insurance Corporation's webinar series on Stop COVID Deaths. How time flies, and this is already our 10th webinar. It really didn't seem that long ago that we were only planning this, and now we are moving on to the double digits for our webinar po. I am Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, the University of the Philippines, Manila National Institutes of Health. And with me, as always, is my mentor and co-host and partner in crime for this webinar series, Dr. Susie Pineda Mercado, Board Member of the Philippine Health Insurance Corporation. Dr. Susie?
Hi, good afternoon, Raymond. Magandang hapon po sa lahat ng mga kasama natin dito sa webinar. Raymond, mukhang gupit na gupit ka na, no? Bukas na yung barbero mo. Dati nung nagsimula tayo, medyo mahaba pa yung buhok. Okay, so anyway, welcome everyone. We appreciate the time that you put in for Fridays na nandito kayo. We promise you a very exciting session today. And we're looking forward to hearing from our speaker who will be talking about infections in children.
Thank you.
Yeah.
Thank you, Dr. Susie. As always, this webinar series would not have been possible without the cooperation and teamwork by the following offices, which starts at the top of the University of the Philippines System, Office of the President, and Office of the Executive Vice President, as represented by Executive Vice President Dr. Teodoro Herbosa, the Office of the Vice President for Public Affairs, Dr. Elena Pernia, AVP Rica Abad, and also Director Timmy Cabana of EMPRO, Director, and also the Executive Director of TVUP, Professor Emeritus Dr. Gigi Alfonso, our tech team also from the UP ITDC led by Director Paulo Paje. Over at the UP Manila side, it's the National Telehealth Center, our staff, and also our teammates po over at the Philippine General Hospital and University of the Philippines Manila leadership. And also at the Philippine Health Insurance Corporation side po, led by President and CEO Brigadier General Ricardo Morales, and also represented by board member Dr. Susie Pineda Mercado. Dr. Susie?
Yes, Raymond, and for those of you who are with us live, you could let your friends know that you can continue to rewatch or have a watch party on this webinar on Facebook and on TVUP. So we're trying to make this series available to as many people as possible, and later Raymond will tell us saan nanggagaling yung mga nakikinig sa atin ngayon. And today we're going to feature a talk from a specialist not from Metro Manila, but from Davao, from the largest hospital there, or I think it's the largest hospital in the country, the Southern Philippines Medical Center. So stay with us, and for those who are watching on the playback, welcome to this webinar.
Thank you, Dr. Susie. And with us also is one of the more distinguished scientists in the country. I will let Dr. Susie introduce him as the one who will deliver the opening remarks for our webinar number 10. Dr. Susie?
Okay, so before I introduce Raymond, teka muna, are you going to tell them about the certificates?
Oh, okay. So about the certificates, we have been getting all of your emails po, no? As mentioned, the certificates will be issued to those who have spent at least 50% of the webinar duration. All the attendees for each of the webinars will be handed their certificates for each of the webinars, and also a link to the presentation for each of those webinars that you have attended. So please keep an eye out on your email inboxes. We are just collating all of the necessary signatures, and we will be sending them over in the next week or so. Over to you, Dr. Susie.
Okay, thanks. So to open our webinar today, we've got a very distinguished guest. We try to get introductory speakers from both from the University of the Philippines and from the Philippine Health Insurance Corporation. Today, it's my honor to present or introduce our introductory speaker, who is somebody you probably are very familiar with. He used to be Undersecretary of the Department of Health and has been a scientist for the longest time and he's currently the Dean of the UP College of Public Health. We'd like to welcome Dr. Vicente Belisario Jr., or to many of us, he's Dean June. June, welcome to the webinar.
Many thanks, Susie Mercado, very good friend. Of course, Dr. Raymond Sarmiento, Director Telehealth Center. Good to see you, the dynamic duo, no, in this Noon Times webinar series. We are in the 10th webinar series. Congratulations to the organizers, UP System, Philippine Health Insurance Corporation for joining forces to actually host this very important event. No? Nowadays, it's a lot of webinars here and there. And I should say this is one of the more important ones that I think is highly commendable. So the partnership of UP and the Philippine Health Insurance Corporation is quite laudable. We have a total of 126 participants that we'd like to welcome in this webinar series, Stopping COVID Deaths. Very, very pleased, and I thank the organizers for inviting yours truly, representing the College of Public Health, your regional center for public health of the CIMEO TropMed, no, in Southeast Asia. We talk about stopping COVID deaths. Where does it all begin? It all begins with public health and prevention. No, and therefore, we're very pleased that you will hear just a bit. No, I'm not the main speaker today, but I'm happy to infuse a bit more of public health in this time of COVID. No, Doc Susie, no, you will understand me quite well. No, you're public health yourself. Dr. Susie, by the way, is one of our highly commendable MPH graduates of our public health program.
And don't ask me, June. Don't ask what year. But yes, I was a graduate of the UP College of Public Health and met so many friends who are in practice, and I hope some of them are listening on the webinar, June, because we have people from all over the country, including provincial city health officers, many of who are graduates of the UP College of Public Health. So I'm sure they're very happy to see you and to know of the participation of UPCPH.
Excellent. And of course, we look forward to participating even more actively in future fora. And maybe it's just a suggestion, UP, PHIC, maybe a feature later on just focus on public health and COVID.
I think let's do that, June. Let's do an entire different series. So lumalaki, don't suggest anything because when you suggest it, you become in charge, right? So Raymond, what do you think?
So we are really privileged and honored to have you, Dean June. It's been a long time since I saw you in person, but you're looking good and healthy po. That's good to hear, sir. I believe you have a set of
you
would like to use, sir.
May I share the screen then? Just a few. I will not bore you with too many things.
Go ahead, Dean June.
Okay, can you see the PowerPoint? Yes or no?
Yep, we can see it.
Yes, sir. Yes, sir. Go ahead.
Okay, just to open this Noon Times 10th webinar on Stop COVID Deaths, focused on COVID-19 in children. We're privileged, and it is our pleasure to have Dr. Delta Aguilar of the Southern Philippines Medical Center. You know, Susie, when I was USEC, that was one of my favorite hospitals of DOH.
Yes.
SPMC. Yeah. Fantastic. It's now the biggest hospital in the Philippines.
Yes.
Very dynamic leadership team there. No? And of course, Dr. Bong Vega, who's now USEC, no, is quite notable himself. No? To talk about COVID-19 and children, a pediatric, no less than a pediatric infectious disease in the front lines, no, spearheading the presentation today. Just a little bit as an introduction, stopping COVID deaths. Just a glimpse of what's going on in the Philippines as far as COVID-19 is concerned. You have the figure on the right-hand side of the slide showing the trajectory of cases over time. We'd like to think we're doing better than before. Of course, it's still a wish. No, but really we're highly challenged, Doc Susie and Doc Raymond, and simply because there are continuing delays in testing and transmission of results. We're still not experiencing, Doc Susie, the enhanced contact tracing that is so necessary when you're looking at an outbreak like COVID-19. Delays in response, therefore, emanate from the delay in data collection, processing, analysis, and transmission. We're not able to respond as quickly as we can We have a lag time now of roughly something like 1 to 2 weeks, diminished from 2 to 3 weeks now, some weeks ago. There is variable capacity in responding to this pandemic across the archipelago because we have a decentralized health system, among others. So the numbers from the DOH dashboard as of yesterday indicate more than 30,000 cases, more than 1,000 deaths. Okay, and we do need to do better, tied up with each other in terms of a collaborative response. We're very pleased. You have an interagency task force leading all of us, and we have technical experts participating there. But how I wish Doc Susie and Doc Raymond that the expertise being shared, no, in the IATF will actually cull data that is consensus coming from the experts. So there's some confusion. Expert one says this, and the other expert says another thing. Another group says this, and another group says that. Now, by all means, let's come up with a consensus so that we have one voice. Where are we now, and what do we need to do? We have a decentralized health system, and therefore we expect varying capacities across local government units, which leads us, Doc Susie, in a major message of this opening remark that there's an immense need now to capacitate not just the Department of Health at central and regional levels, as well as the local government units that experts and academic institutions must address sometime soon. Okay? And therefore, we need to enhance the role now of science and experts. I trust that the presentation today will see the evidence also on what Southern Philippines Medical Center has done in relation to minimizing, reducing COVID deaths among children in that major medical center in Southern Philippines. The role of science and experts, the sharing of knowledge and learnings as we will experience in today's forum will be very, very important moving forward in addressing this pandemic. Without further ado, I'd like to thank this chance to interact with you today and look forward to more public health discussions in the near future. The bottom line really is helping each other in this time of pandemic, helping each other in addressing public health concerns. It's really the collaborative spirit depicted by Bayanihan, by Botong Francisco, as you see on the screen. Maraming salamat. We're looking forward to a very learning field session this afternoon. And isang mapagpalang araw po sa ating lahat. Many thanks.
Dr. Susie, please unmute yourself.
Okay, thank you very much, Dean June. I think you're right, no? At this point of the pandemic, when we started this series, really there was a very big concern for clinical management because that was the time that we saw hospitals being filled up and not really knowing, a lot of people out there not really knowing what to do. And I think as we move into another phase of the pandemic, I absolutely agree with you that public health measures like contact tracing and better isolation facilities in local areas is going to be a key. So we should really look toward a partnership on some other aspects of the pandemic.
Thank you, Dean June, for that inspiring opening remarks, sir. That was really a message filled in terms of focusing on the need for a consensus. What are the recommendations in terms of reducing the delays in our response, and especially the need for having sort of an emphasis on the teamwork or the bayanihan spirit po. Especially with your last slide with Carlos Botong Francisco's painting. Thank you so much, Dean June. And then before we move on to our resource speaker po, may I enjoin everyone who is attending to participate in our fun quiz, which is our traditional pre-webinar set of questions. So the ones that are shown here are just 2 questions. The first one is a true or false question. It says, when taking care of a pediatric patient with non-severe COVID symptoms, is it essential to avoid direct contact with the child's secretions or stool? So please put in your answers po. It's just 2. So it's true or false lang naman po yun. And the second question reads, any child who is less than 12 months old with cough or difficulty of breathing plus at least one of the following symptoms can be classified as suspect COVID-19 case with severe or critical symptoms except option A, central cyanosis, option B, severe chest indrawing, option C, positive Babinski reflex, and option D, lethargy. So please put in your answers po. We nearly have 50 respondents at the very least for option A, and then option B also has more than 50 respondents moving on. So please continue on to put in your answers for these two pre-webinar questions. We will ask our research speaker to provide the correct answers towards the end of our webinar. And then I will give the floor now to Dr. Susie for the introduction of our research speaker.
Thank you very much, Raymond. And hold on to those questions in the poll, because sometimes it's those questions. Well, the speaker actually chooses the questions. And I guess that's the way of the speaker saying, these are the most important points we want you to take home from this webinar. Anyway, so we're going to talk about children. And I think it's a great concern for everybody, especially for those of us who are parents in the audience, those who are listening, because we've kept the kids away from public places. We've shut down the schools, and at some point in time, school may open in a modified way. But we would like to hear more about, how does COVID impact on children? Are there cases of children who get COVID in the Philippines? How about children who have other diseases, who have to go to a hospital and could get infected with COVID? How about exposure of children to adults? And so many other issues. How about children who have immune system diseases? What do we do to protect them? Those who are undergoing chemotherapy. Marami tayong tanong, no? So for this afternoon, we are delighted that we have been able to get from her very, very, very busy schedule a pediatric specialist in infectious diseases. And as mentioned earlier, she's coming out of the biggest hospital of the Philippines, the Southern Philippines Medical Center. And she's here to share her experience and to talk about COVID-19 and children. Let's welcome Dr. Delta Aguilar. Dr. Aguilar, welcome to our webinar.
Good afternoon, Doc Susie, Doc Raymond, and everyone.
Good afternoon, Dr. Delta. How are you?
Oh,
I'm
kamusta
good.
dyan sa Davao?
I'm good. Davao is hot in the morning and rainy at night.
Yeah. And are you seeing a lot of kids who have COVID in Davao?
We do have a share of COVID positive in pediatrics, but I think globally it's still minimal. So we have only around 49 to date, and we have only 3 deaths.
Wow, okay. So that means we do have children who are getting COVID, and children can die of COVID. And Dr. Delta, have you seen what they've reported in Europe and the US, this sort of multi-organ inflammatory syndrome, or that's like Kawasaki's disease? Have you seen that in your practice?
In our practice, I haven't seen one, but we have cases who are children comes in with fever and rash. Apparently, they don't test positive on COVID. So we are yet to see a case of the multi-inflammatory system associated with COVID in children.
Okay, great. Okay, so we're not gonna keep the audience away from your talk. Please proceed with your presentation, Dr. Delta.
Okay, so let me share the slide. Okay, so good afternoon, everyone. I would like to thank UP and PhilHealth organizers for this invitation. Reports were mainly on Metro Manila events, and now this is an opportune time to hear what is happening further down south. I will be talking about COVID-19 in children, the Southern Philippines Medical Center experience. The main bulk of this talk is sharing our experience in SPMC as we respond to this pandemic. So the outline of my talk will start with COVID-19 updates, SPMC and Davao's timeline, our strengths and weaknesses, our challenges, and moving forward our future directions. So SARS-CoV-2, which is the main virus of the COVID-19, is such a democratic virus that it does not discriminate the young, the poor, the old, the rich. In that saying, children are not spared. So we have COVID-19 cases in children. So let me give you a glimpse of the global update. According to the Johns Hopkins dashboard, we have a total of 9.4 total confirmed cases and around less than 500,000 deaths in 188 countries. And topping from the list of confirmed cases by country is the US, followed by Brazil and Russia, which the Philippines ranked number 39, but third in Southeast Asia, following Indonesia and then Singapore. Now, in the Philippines, as of June 24, we have accounted 32,000 total number of cases with 1,200 deaths. Now, for the pediatric COVID cases, from the Philippine situationer as of June 21, it shows the breakdown of cases, particularly for the pediatric age. And it tells us that there are about 2,300, and much of the bulk of these cases are from the 15 to the 19 age group, while the deaths were accounted among the 0 to 4 years of age. Now, for age and sex distribution, we see that there are more males affected compared to that of the females. Now, COVID in children are less frequently observed, and that worldwide, children are also less likely to be tested due to mild presentation of the disease. Most common symptoms are fever and cough. Other symptoms are sore throat, difficulty of breathing, rhinorrhea, diarrhea, vomiting, abdominal pain, fatigue, headache, myalgia, and rash. Now, this is an April 10 MMWR report that tells us that in the United States, 22% of the population is made up of pediatrics. And among those who are laboratory confirmed cases with known age, they have 149,000 cases, and 1.7% of which are from the children. That is less than 18 years of age compared to that of the adults. The median age is about 11 years of age. I will not go through lots of the statistics, but it is noteworthy to say that most of those affected have history of travel and exposure to a known COVID-19 patient. And the most common presentation are fever, cough, shortness of breath in children. Now, this MMWR article also tells us that there were about 3 deaths reported from these 2,572 cases, to tell us that most COVID-19 cases in children are not severe, and serious COVID-19 illness resulting in hospitalization can still occur. In another article, this was done in China, SARS-CoV infection in children by Liu and Liu. This tells us that in the 72,314 cases by the Chinese Center for Disease Control, less than 1% of the cases were younger than 10 years of age, seen at the Wuhan Children's Hospital, which was the pediatric referral center, and that 1,391 children tested with about 171 or 12.3% confirmed case, and males were more than that of the females as discovered, with a median age of 6.7 years. Fever was the most common presenting symptom, and there was 1 noted death. In another article published in Italy by Pari Brancesino et al. On children COVID-19 in pediatric emergency departments in Italy, children younger than 18 years of age who had COVID-19 composed only 1% of the total number of patients. 11% of these children were hospitalized and none died. The mean age was 3.3 years of age. There was a known exposure for about 12% who appeared ill. Again, fever was the presenting symptoms, followed by cough, difficulty of breathing. There were also those patients who needed oxygen and respiratory support. There were 6 coexisting conditions, but 0 death. So this study in Italy is very informative, in which it compares all the other 3 other studies of the cohort. But it is suffice to say that the confidence study in Italy, as mentioned earlier, failed 0 deaths. Now, let me introduce to you to my institution, the Southern Philippines Medical Center. This is sort of the PGH of Mindanao. We are located in Davao region or Region 11. It is composed of 5 provinces, 6 cities, more than 1,000 barangay, 43 municipalities, 11 congressional districts, and SPMC has become a main referral center for challenging cases in Mindanao. Now, SPM has a 1,500 bed capacity, a tertiary government hospital under the Department of Health, a multidisciplinary, academically affiliated medical institution with a century of service, passion, mission, care for all. We are guided by our beloved medical director and now recently appointed Undersecretary for Admin and Finance, Dr. Waldo J. Vega. Now let me give you a glimpse of what a SPMC bulletin is. So the SPMC bulletin is updated daily and published almost daily with outcome trends of patient and confirmed 19 in Southern Philippines Medical Center. They present the number of total positives, recoveries and death, and to date, as of yesterday, we have about 411 total positive cases with about 30 deaths. It also presents graphical presentation of our total positive, active cases, recoveries, and death, and the percentages of these cumulative recoveries, active cases, cumulative deaths per day. Now, let me go through the Davao timeline. Did you know that the start of the COVID pandemic was from a pediatric case? So the first pediatric scare in COVID was in January 21, 2020, when a 5-year-old boy with a history of travel from Wuhan was admitted in Cebu and tested positive for pan-corona assay, which was later sent to Australia for virus identification. This turned out negative for SARS-CoV-2. Now, the first case in Davao was reported on March 15, 2020. This was a case of a 21-year-old from Pantukan, Davao de Oro, who had a travel history from UK to Manila to Davao February 29. Thereafter, the news from Metro Manila of local transmission, Davao and was put under GCQ. Now, on March 29, 2020, first pediatric patient was admitted. This was a case of a 15-year-old female respiratory tract infection with acute gastritis and a history of exposure to COVID positives. March 30, our mayor Inday Sara reported that there is already local transmission in Davao, and by Executive Order 23, that placed on ECQ. Moving further, on April 6, 2020, 6 out of the 11 confirmed deaths in Davao region was attributed to the Matina cockfighting. A total of 18 corona deaths from COVID positive was reported, and about more than 400 attendees. This was a very important landmark in Davao history because the Matina fight derby Pandora box that opened the COVID-19 in Davao City. On April 9, 2020, we reported the first COVID case of an 18-year-old Hodgkin lymphoma. On May 9, 2020, we reported the second death, a 24-day-old baby boy with neonatal sepsis, acute gastroenteritis with severe dehydration. On 14, 2020, we have the third report of COVID death from a 10-year-old female with secondary to myocarditis, and there we are on watchful waiting for our number of increased cases. Now, date, our pediatric COVID-19 confirmed cases are 47, 3 mortality, and tested about 577 patients, and we have 47 confirmed patients as of June 22, 2020. Mayor Inday Sara, Executive Order number 28, stated that all private hospitals in Davao City are not allowed to admit PUIs and COVID-19 positive patients. The Southern Philippines Medical Center shall be a hospital for severe and critical COVID-19 PUI and patients. All centers available for PUI shall give patient referral to SPMC. This is flow happening in Davao for pediatric patients. We get receive patients from private hospital, from our inpatient, those by family medicine. They are being and exam risk that is based on they are probable, mild, moderate, severe, or confirmed COVID. And what is unique in Davao City is that all these categories have been provided areas or accommodate these patients. Drafted our own pediatric COVID-19 guidelines, but of course, this has been adopted from the Pediatric Society interim guideline on the screening, assessment, and management of pediatric patients with suspected or corona disease 2020 as of March 30, 2020. And this has been submitted to the Office of the Medical Professional Services and issued memorandum numbers. Now, let me share to you the baseline characteristics of pediatric COVID positive patients in Southern Philippines Medical Center as of June 22, 2020. We have a total of 47 patients with 28 females and 19 males. Mostly have declared history of exposure, that's about 31 out of the 47, and 16 have no exposure. As for age, we have seen that age 14 and 15 to 18 are those that are affected by this COVID positive, and that the least groups affected were the neonates and those 1 month to 1 year. We have also reported that our length of stay would average to about 18 days, with the shortest reported at 23 hours and longest at 31 days. Now for the symptoms, parallel to the other presenting symptoms in other countries, fever, cough, and difficulty of breathing and also diarrhea were the main presenting symptoms of our pediatric confirmed cases. And we have 23 asymptomatic patients as well. These patients came in with concomitant disease. Topping the disease association was acute gastroenteritis, followed by upper respiratory tract infection and pneumonia. Now, for the mean laboratory values of this pediatric COVID positive patient, we found out that WBC average was about 11.2, neutrophils was about 54, lymphocytes at 33, platelet normal at 355, CRP was positive at 3.5, LDH at 890, and serum ferritin at 524. For the radiologic findings, 35 of the 47 patients presented with unremarkable chest X-ray, while 8 presented with pneumonia, 2 presented with consolidation, 1 with low-borne pneumonia, and 1 with pleural effusion. For complications, we have reported pneumonia as the most common complication, and we also have seen ARDS, respiratory failure, disseminated TB, septic shock, and neonatal sepsis. Now for the treatment options that we have utilized in our institution, we have 2 cases that were given hydroxychloroquine plus azithromycin, 12 cases with azithromycin, and 2 cases with IVIG. Now, let me run through the pediatric COVID-19 mortality report. So we have 3 deaths now with the 49 COVID positive pediatric patients. Our first case was an 18-year-old male with Hodgkin's lymphoma who underwent chemotherapy and radiotherapy. This patient is not originally from Davao, but stayed in our halfway house, Capernaum, for the chemotherapy session. Now, this patient has no known history of exposure, but apparently, since this is a teenager, this patient was seen lingering around SPMC, of which during that time was a hotspot for all COVID cases. The chief complaint was fever and chest pain, and his chest X-ray showed bilateral pneumonia. He stayed for 8 days, but succumbed to death due to ARDS secondary to PCAP-D with hypoxia. Our second patient, our second COVID death, is a 25-day-old male with appropriate for gestational age. He came from a very high-risk barangay, 23C from Davao City, and the history of exposure revealed that the mother and the mother also tested COVID positive. This patient came in with diarrhea and fever, and chest X-ray showed neonatal pneumonia. This patient only stayed for less than 2 days and died due to septic shock secondary to neonatal sepsis, neonatal pneumonia, acute gastroenteritis with severe dehydration, multiple electrolyte imbalance. Our third death was a 10-year-old female with healthcare-associated pneumonia, to consider rheumatic heart disease, who comes from Samal with unknown history of exposure. Patient came in with difficulty of breathing, chest x-ray showed consolidative pneumonia. Length of stay was 23 hours only, and this patient succumbed to death due to respiratory failure secondary to PCAPD versus ARDS with congestive heart failure secondary to myocarditis. So these were our three mortalities, and this gave us very good lessons. Now let me bring you through our strengths and weaknesses. We have identified that leadership, human resources, infrastructure and material resources, systems and protocols, and team collaboration as our strength. I would like to emphasize that Southern Philippines Medical Center have strength with our strong medical leadership and government control. It is noteworthy to say that under Dr. Yvette Barres, our infection control head, we have developed guidelines together with the adults and have instituted them in our medical center, of which everyone is being guided. Our mayor has also been very supportive of our recommendations, and Davao City was the first to respond to the medical call and the medical need for consults. There were a group of doctors who have created Tawag Kay Doc, which was patched with our 911, wherein residents of Davao City can call this number, being patched to a doctor, and they're being consulted, seen, and prescribed with medications and provided with control numbers from 911 so they can avail of the meds and buy them to our Davao pharmacies. Our mayor also have tapped the military to help in putting peace and order in the implementation of the lockdown. And what is also unique in Davao City is that we have a very active Facebook account that tells everyone of the areas of high risk, very high risk in Davao City. So everyone can just access the Facebook and they can get the information. And of course, we are in partner with PhilHealth, of which most of our COVID suspects and COVID patients recovers or are brought home with zero balance billing. Now, we have strength also in our human resources, and we cannot discount the fact that our medical residents, nurses, nursing aides, medtechs, housekeeping, pharmacy, rad tech, and guards are also with us in this crisis. We do not stop with our resource augmentation for backup. So as it is now, Southern Philippines still needs more of the human resource to help in this crisis. And more so, our department, the Department of Pediatrics, is in need of residency applicants. Now, we also conduct human resource training as demonstrated with our PPE and donning and doffing practices and other preventive infection control measures. We also provide them with psychological support. There is a trunk line of which any healthcare worker can call and talk to, and we have provided them with shelter, transportation, and service, and even food from donors and from the dietary. There are also areas in SPMC, particularly the Children's Cancer Unit, who provided free flu vaccination to all medical personnel, staff, patients, and even carers. Now, for those health personnel who get sick, we have the Personnel Health Service Monitoring and Surveillance, where they trace, track, test, and treat, and we follow this guideline. And of course, we have strength in our infrastructure and material resources. There's already been existing establishment. We have a few renovations, and we did some of also innovations. And there is also a treatment facility of which was opened recently, last May 22, which is now being utilized as an area for asymptomatic and mild COVID pediatric patients. Now, for expanding test capacity, we have 4 PCRs and a very dedicated personnel who help us in the diagnostic nasopharyngeal and oropharyngeal swabbing. Our material resources are also donated from private sectors, of which we would want to commend and thank them for. And we have also systems and protocols in place. So COVID-19 consultation for residents of Davao City has been disseminated through print, radio, and web media, and that they can always access our 911 for further instructions. Now, we also take pride in we work with the other local governments, and we engage with the DOH in their coordinated activities. And also, we are one in networking as we extend our knowledge with the University of Barcelona with their webinar series and Fujian Medical Hospital. These webinars were conducted at least once a month. MOA signing between UP Mindanao and Southern Philippines Medical Center on joint intensive training program on SARS-CoV-2 molecular diagnostics was also done last May 26, 2020. Now, despite all those strengths, we adhere to some weaknesses, and that is one, surge capacity and infrastructure. We admit that with high census, there will be laboratory testing capacity depletion, and that we will also be needing more ICU beds, more spaces for more patients. The supply chain and depletion and disruption is one of our weakness. Despite all the supplies coming, I'm sure we will get to a point that we will get depleted. Plus, of course, with all the travel restrictions, the supply will come in a hefty schedule. And we also recognize cultural resilience as one of our weakness. When the restrictions get relaxed, people tend to rely on cultural practices. And I'm sure everyone is aware of some of these practices, which also gives psychosocial impact. Now, what about our challenges? Now, Southern Philippines Medical Center have adopted the virtual consultation or teleconsultation, of which is challenging for everyone because not all have the Wi-Fi, not all can access the application, and not all knows how to engage in this digital technology. But in the teleconsultation, we have waiver and consent, and we share prescription after consultation. Research has also been a challenge. At the height of the pandemic, all the researches of our residents were put on hold, and that even the ongoing clinical trials were put on hold. Another challenge would be, aside from getting busy with COVID, we expect that there will be dengue, there will be flu season, and there will be cases of leptospirosis. Now, moving forward, for our future directions, we have no choice but to adapt to the new normal. And one of which is engaging our consultants and our residents and even the residents of Davao City on telemedicine. So we will be working remotely. And of course, vaccines. Are we any closer to a vaccine? For the Asian vaccine development, South Korea announced that they are in phase 1 and 2. So again, this vaccine development is still a future that we need to wait for. We are one with our national government, and SPMC foresees the need to build the creation of an infectious disease institute, and much more to that nearer future, the completion of our Southern Philippines Children's Hospital. In conclusion, the exact impact of COVID-19 pandemic will be substantial and pervasive. Rapid and sustainable COVID-19 response is crucial in decision-making and management calls. Protecting healthcare workers and enhancing infection control measures should still be our top priorities, and SPMC will need to adapt to the new normal. Thank you very much.
Thank you so much, Dr. Delta. That was something of an eye-opener po in terms of understanding the experiences from a pediatric perspective for COVID-19. And you mentioned also Dr. Yvette Bares. So Dr. Yvette Bares was actually one of our speakers for webinar number 2, Dr. Delta, together with, I believe, Dr. Regina Burba.
Yes.
is the head of the Hospital Infection Control Unit over the Philippine General Hospital. Before we move on to our Q&A portion, we have here, as seen by our attendees in Zoom, which are now numbering at 221 participants right now, is an evaluation po of our presenter, Dr. Delta Aguilar. And obviously, your presentation po, no, Ma'am Delta, it was really well received. A lot of our attendees agree that you have demonstrated thorough knowledge of the topic. You're well prepared and organized, and did not have any issues with regards to audio and video, and use appropriate language for when talking about technical and medical jargons po. So maraming salamat po for that, Dr. Delta. Before we move on to our Q&A, I will give the floor to Dr. Susie.
Thank you very much, Dr. Delta Aguilar, for that. Again, as Raymond said, an eye-opening presentation. I think, we heard about this Matina cockfight thing twice or three times already on this webinar series. And I think it's really noteworthy that we pay attention to some of these events that really create a big problem in the community. I mean, in Korea, for example, there was a religious event, or in Singapore, there was an influx of certain migrant workers. So I think we all learned a lot from your presentation. We'd like to thank you for all the time and effort that went into putting that presentation together. Maraming salamat po. So we have a couple of questions. Let me fire the first question here, Raymond, from Jonathan. So Dr. is asking, how was IVG given to your patients? And for those who were given hydrochloroquine, did you have any adverse events?
Okay, so to answer the first question, the IVIG was given to two patients. One was a case of a disseminated tuberculosis. So we exhausted bacterial intervention in terms of antibiotics. And at that time, we could not initiate hydrochloroquine because of some cardiac issues. So we opted for IVIG, of which PhilHealth has assisted us. So it was a very good move, since IVIG has not been a new treatment option for pediatrics. It's one intervention we give for sepsis. So it was hitting two issues already. One for a known intervention for COVID-19, and the other one particularly was for the infection for this disseminated patient. The other one on the use of the IVIG on that other patient was also in line with sepsis. So for pediatrics, it's easy for us to use IVIG as one of our last resort after exhausting antibiotics, because it's one already of the recommended intervention in terms of fighting infection. As for hydroxychloroquine, we only have two experience. One, it was started on the initial cases. So when Wuhan, China have recommended this use, we adapted to it. But in reality, we did not really see good response about it. We were not outrightly starting it, since there are a lot of preparations to start hydrochloroquine. We have to make sure that the child has been cardio and pulmonarily cleared before starting it. So we started it as part of the intervention, although we don't really know the exact effect. But at that time, and as recommended by the Philippine Pediatric Society with the meager evidence, that was one of the recommended treatment. So alongside with the usual treatment of that particular case, we gave hydroxychloroquine plus azithromycin.
Right. So it's really changing, no? The management is changing
Yes.
Quickly. And that's why it's really so important to be updated. And these webinars are really meant to help update our practitioners. There's a question here about whether you admit mild cases of COVID-19 patients and what kind of management do you give them?
So in Davao City, what is unique is that our mayor has been fierce on stating that all private hospitals will not accept complaints or children who present with fever, cough, diarrhea for that matter. So in the initial stages of this pandemic, everyone was so strict on these rules. So everyone who presents with this would be assessed, and minimal diagnostics will be asked, like CBC and chest x-ray. should the chest X-ray reveal pneumonia, all these patients, whether rich or poor, and if you really wanted to be admitted, are directed to SPMC. Therefore, even mild cases are admitted and swabbed. So that's one unique practice in Davao. We do not discriminate anyone. It's just that some of the well-to-dos are hesitant to go. So for those who do not want to be admitted, we offer OPD for these patients, and we give out numbers for them to call in terms of follow-up in case they really do not want to be admitted. But again, all the mild, moderate, severe, and critical cases are suggested to be admitted, and SPMC is open to all.
Okay, so I think that's really a very good practice when we're looking at localities, certain localities that you've got a very strict referral network system, because I think that's been the problem in many places where, patients go from hospital to hospital and they're not getting admitted because it's not clear. So that clarity is very important. There's another question here. Can you give, so this is from Emmanuel, can you give a rundown of common clinical and laboratory findings for the pediatric patient? So what did you see that was common in your diagnostics?
So the most common presentation remains to be fever and cough. And once in a while, we get diarrhea. Now, for the common laboratory parameters, it's really variable because most of the CBC can either present with leukocytosis, leukopenia, or normal platelet. So the CBC doesn't seem to be a very good parameter as to saying that that patient is COVID, because it can present either to be increased WBC or low WBC.
Yeah.
But one of our main link would be a chest X-ray. So if the chest X-ray reveals pneumonia, be it bilateral infiltrates or lobar or consolidation, we direct them, and we have high suspicion that this can be a COVID suspect.
Okay, so the chest X-ray becomes a very important tool for your thinking about, should I classify as COVID or non-COVID? Another question here. On determination of cause of death, were you performing any autopsies at SPMC for children?
Apparently, no autopsies were done. It was not allowed. So most of our deaths were also advised cremation. For those who could not afford cremation, the government gives support as for either a double bag, a metal carrier, or transportation as to where these victims or the families will be going to. So biopsy, it has never been done.
Okay.
Autopsy
Raymond.
rather. Autopsy
Yeah.
rather.
Okay. Raymond, over to you. There are ang daming question dito, Dr. Delta. Tsaka, you have one of the highest, the most well-attended webinar. Ang daming, so many people are on the webinar right now.
Thank you.
So many more po sa YouTube. Dr. Delta.
Thank you.
Questions also po are trickling in. This is also one of those webinars po with a lot of questions. I think it's particularly because of the pediatric ID specialty, no? Questions po though, as per the pathology report, were there any significant findings for, or anything of that sort that was in terms of the biopsy that was done, or anything of that sort for the pediatric patients po?
Particularly for Southern Philippines Medical Center, we did not do any biopsy. So I could not give further answer to that question. But there have been reports as for ARDS and other damage. But again, for SPMC experience, we do not have any autopsy nor biopsy of our COVID deaths.
Opo. Thank you, Dr. Delta. There's a question here as to, so epidemiologically speaking, the severe form of COVID-19 is very, very rarely seen po sa children. Any thoughts why that is so daw po? And parang does age have sort of like a correlation in terms of quote-unquote protective effect po on the infection or anything that's...
Yes, so most of the COVID-19 infection in children are really mild, and those who went into severe cases really have comorbidities. Now, there are factors that they wanted to account with it. One is they say that our cytokine storm is less because of our less chemicals in the lungs. That is in terms of myeloperoxidase, our interleukin 6 and interleukin 10. There are also other reports as to saying that we have decreased susceptibility because most of our immune system can cross-protect us with other viruses. So we have already been exposed and children are likely to adapt to these viruses already. Another possible reason as to its decreased susceptibility is that most of that experienced by children are mild. Some are symptom-free. So the thing is they don't really get detected. And another one is that because children have less high contact experience, meaning we just stay home or they just, they are interacting with children as well, the transmission is also less. So these are the reasons why we see that children are less likely to develop COVID-19.
Okay. Thank you, Dr. Delta. With the recently released results of the recovery trial espousing the benefits of administering dexamethasone as a possible drug, is that something that SPMC has included in terms of their management protocol? Is that something that you have been giving for pediatric patients po?
Dexamethasone has always been used in pediatric care, but the use of it still warrants as to what criteria will qualify for these patients to be given. So currently, for SPMC, we do not have a case where it warrants the need of dexamethasone. So again, our treatment protocol would be addressing the complaint, the diseases involved, and should there be a need for dexamethasone, then we are also open to using it. But in our past experience, we have not used it yet.
Yeah, you know, we talked about this last time, Raymond, but I'd just like to reiterate it now because we've got a lot of doctors out there who can advise the patients now, because when the news on dexamethasone came out, people thought they'd buy it over the counter and drink it, no?
Yeah.
So please, please, please remind all your patients not to self-medicate. Kasi when they see that, we're seeing so many of these cases where people try things because they saw it on the internet, and it can cause more problems than not. And it's the doctors who can really tell the patients na please do not drink anything that is not prescribed by the doctor, especially for COVID-19. There's a question here, Doctora, about, just to clarify, the treatment for children and adults is fairly the same?
I would say it's not the same because the direction of treatment for COVID-19 in children is still based on the concomitant disease presentation. So we still maximize the use of antibiotics and we treat as the symptom appear. Well, for adults, most of their COVID-19 probable, severe, and those who succumb to death really have a very challenging course. So treatment-wise, it's quite different because most of them really are very stormy, while that of children seems to be like a management case of treating the way that children present it with their diseases. So
Right.
it's sort of just doing whatever we do already in the past.
Yes. So I think that's a very important point because there's no formula for the treatment of
Right.
COVID. Actually, you really have to assess the presentation, the history. And if you have pre-existing disease, then you have to take that into account. And therefore, there's kind of like a very individualized way of dealing with COVID-19 in children. Raymond, I think there are a couple of more questions. You want to take them?
The other questions po, so with regards po, Dr. Delta, sa recommendations on breastfeeding, there are multiple confusing guidelines po based on the specialty society that you are referring to. So as per the Pediatric Association, Pediatric Society po, and your recommendation with regards to breastfeeding.
we allow breastfeeding in COVID positive neonates, and the mother just have to be aware of the preventive measures such as wearing of the mask and frequent hand washing. So we do not isolate the mom and the child just so there is sort of stopping the transmission of the disease, because again we still believe that the breast milk has a lot more to give rather than the risk of infection. So we just really have to remind the mother of strict preventive measures so as not to um, closely transmit it to the baby.
Okay. Thank you, Dr. Delta. That was very, very clear. And I think that's very important to emphasize na mag-breastfeeding po. Kasi marami po talaga natatakot po sa ngayon at iniiwasan po na mag-breastfeeding. And the benefits really outweigh po
Yes, right.
the negative consequences. Another question po, is SPMC involved in any trial with regards to convalescent plasma therapy?
We are part of the Solidarity Trial of the WHO, so our adult counterpart. And during the initial talks of convalescent plasma, most of our consultants involved, like the hematologist, the pathologist, have already prepared guideline and protocols on convalescent plasma. So we are excited on this particular treatment modality.
Okay. Other questions that we have been receiving, Dr. Delta, is with regards to how did SPMC Pediatric OPD manage their regular patients po? Was the pediatrics department completely inpatient at that point in time? Paano po yung parang pagkakahiwalay po ba ng mga pasyente?
Okay, so despite being a COVID center, since there is only one large government hospital in Davao that can cater also to the masses, we cannot close SPMC and tag it as solely a COVID hospital. We still cater non-COVID cases. So we have an isolation facility of which patients who come in with fever, respiratory symptoms, and diarrhea are being entertained, while those without symptoms like trauma or drowning or any other without fever, respiratory cough can go directly to our ER. So our team are divided to COVID and non-COVID teams. So these residents have also zoning areas of which they will not interact with each other. So there has been a process flow in SPMC wherein there are COVID areas and there are non-COVID areas, and everyone are aware of it. So for those really who needs consultation from SPMC, please do not be scared, because we have non-COVID areas to cater for these cases, and we have also isolated facility to cater for the COVID cases.
Thank you very much, Dr. Delta. We also heard about this zoning from the Lung Center, from the Philippine General Hospital, and from Vicente Soto. So apparently our hospitals are reconfigured now for places where pang-COVID lang talaga and places where, okay, pwede yung hindi masyadong COVID. There's a very interesting question here, and I think this could be really very practical for families, where you have a child, let's say, who swabs positive. And I've actually had a patient like this, no, na positive yung isang parent, and then positive yung child, but they're both asymptomatic. Now, in Davao, would you admit these patients, or they just go home and stay in isolation? And what do you recommend for management of the child who tests positive with the swab?
Again, what is unique in Davao, as I mentioned, is that we have a very strict rule on COVID positive. So even how rich you are, but if you are COVID positive, you will be directed to SPMC, even if you are asymptomatic. So the child with a parent comes to our hospital, they will be placed on our isolation facility, or particularly our temporary shelters, yung tent, that's what we call it. So the asymptomatic and those with mild symptoms are admitted there. We always encourage, if not encourage, nobody has ever refused to be admitted.
Okay, so that's great,
all
because
COVID positives are admitted to SPMC.
Yeah, because what I heard was that in Cebu, they were doing what was being done here in Metro Manila in the early part of the pandemic because there were no isolation facilities in Metro Manila. Uh, if you were symptomatic, you just go home. So I think that's being done now in Cebu. And maybe that principle that you're talking about would be very useful information also for our counterparts in Cebu who are seeing a great rise in number of cases. So whether you like it or not, you get admitted to SPMC as
Yes,
long as you're tested positive with the swab. Okay,
right.
so that's very clear.
No choice.
Very
Even our
clear.
doctors, even doctors who work in consultants in SPMC, they have the capacity to stay at home, get isolated, but they will be directed to SPMC.
Wow.
Okay.
That's impressive,
Okay.
Dr. Delta. Oh, so one of the questions that we have, it's a text-in question po, no, Dr. Delta. The question reads, since pediatric patients often have mild symptoms, can they still receive vaccinations, immunizations, or if not, how long after recovery can they receive the immunizations po?
They can still receive all the vaccinations needed. They can still update or catch up their vaccination. But we would say that you give ample time for recovery. So in most cases, just like in any viral infection, we recommend at least a month after the whole disease process that you get to resume to your usual immunization practices.
Okay. I think that's another very important point to make because a lot of parents are wondering about this, about whether or not you can vaccinate. So I think we have taken up a lot of time from Dr. Delta. Maybe if you have one or two more questions, Raymond, we can
Yes.
put the questions
I,
in. Yes.
okay, I have a question very close to my heart, Dr. Delta, since
Go ahead, sir.
National Telehealth Center po, no? You mentioned that SPMC will be moving towards implementation of telemedicine. In terms of the platform that you will be using, how did you evaluate those platforms? Was there an emphasis on more privacy-focused telemedicine platform, that sort of thing? And how do you really disseminate that all across the different departments po?
Sir, okay, so I'll just give you things I've learned about it recently because I have not been involved with the teleconsult team. We utilize the WebEx platform, and what they usually do is they download the app, they go through the um, question. There is a Facebook account and they will be directed to that application and they try to give in what their problem is. There is a waiver and consent uh, form that they need to sign in, although I'm not quite sure, sir, how they do it. But according to my residents, they make sure that it is reported and documented. Then after consultation, they get this prescription.
Okay.
It is the plan. Everything else will be.
Okay. So I think we're looking forward to more telemedicine, telehealth. Raymond, no? Mukhang yan na yung new wave. Hindi
Yes.
second wave, first wave. It's the new wave. Okay, so Raymond, you want to give our audience an idea of where everyone, what's the representation of our participants for today? Kasi marami
So,
pa rin, no? 200
yes.
plus pa rin, yes.
Thank you, Dr. Susie. And following that cue, we have attendees who have registered all the way. So, distribution po, no? We have way from Alcala Municipal Hospital in Cagayan Valley, Region 1, Tarlac Provincial Hospital in Central Luzon, Hong's Children's Center for Cerebral Palsy in Malate, Manila, a rural health unit in Albuera or Moc City, Leyte,
Wow.
and OWA po, the Office of Overseas Workers Welfare Association po in Misamis Oriental in Northern Mindanao. And you are also international po, no, Dr. Delta, because you have participants from the Central Security Hospital in Al Qasim, Saudi Arabia. So,
Thank you.
wide po talaga ang ating attendee list, and we are very fortunate for you to be able to share your learnings and for us to learn from the experiences of SPMC. And I think at this point, if you don't mind, Dr. Delta, this is the time wherein we show our webinar test results. So I think if we could have our attendees answer these. For the first question po, no, it's a true or false question. When taking care of a pediatric patient with non-severe COVID symptoms, it is essential to avoid direct contact with the child's secretions or stool. True or false, ma'am?
True, sir. The right answer is true.
True.
So we
Okay.
really need to avoid secretions.
Thank you, Dr. Delta. And the second one states any child who is less than 12 months old, so less than a year old, with cough or difficulty of breathing, plus at least one of the following symptoms, can be classified as suspect COVID-19 case with severe or critical symptoms, except, what is the except symptom po?
The except is the positive Babinski reflex.
Okay. Thank you. Thank you for answering our questions. That's something that we often do, Dr. Delta, and we look forward to having you in future iterations of the webinar po. Dr. Susie?
Yeah, thank you very much, Dr. Delta. We have a few minutes, so maybe I would just ask you to give some parting words for all our doctors who are out there in rural health units all over the country. What's your message to them about COVID and children?
So as medical personnel, we encourage everyone to unite as one. We wouldn't want to use heal as one because we don't want to get sick. But we wanted to say that let us fight as one. Let us get ready to stand, to find, to isolate, to track, and to treat. And that COVID infection is real. It affects everyone, even our children. Thank you.
Thank you very much. Well said, Dr. Delta. And it's been such a pleasure to have you on the webinar. We
Thank you,
are all very, very proud of what you're doing at the Southern Philippines Medical Center. We have learned so much today from what we call the King City of the South, no, from Davao
Yes.
City. And so much learning, so much sharing that still needs to happen. Maraming salamat po para sa oras nyo na ginugol para sa webinar natin. Salamat. Okay, so next week. Okay, this is a very interesting topic next week, so I hope you'll join us. Many people don't realize that after you get severe COVID, it becomes very difficult to fully function even if you survive. So parang naisip natin, oh, nag-survive, nag-recover, and we see all those numbers coming out that they recover. But actually, there are a number of patients who, because of the severity of the COVID, really still continue to have difficulty breathing. They need to exercise those lung muscles, and in short, they need rehabilitation. So we are going to talk about pulmonary rehabilitation post-severe COVID next week, because we can't say that we've finished our job just because the patient survived. No, the quality of the life of the patient has to be improved, and there are techniques and things that we can do to improve quality of life post-COVID. So we're going to have Dr. Celso Bate, who is from the Philippine Heart Center, and he is going to talk about rehabilitation post-COVID. So join us next Friday. Let's make this a regular habit of keeping ourselves informed and, of course, learning from each other as we fight together. Tama ba yun, Delta? Unite together against COVID. Raymond, over to you.
Thank you, Dr. Susie, and thank you again for that wonderful presentation, Dr. Delta. We learned a lot, especially with how advanced and how state-of-the-art po talaga ang pag-manage po ninyo ng COVID-19 cases, especially at the Southern Philippines Medical Center. So maraming salamat po doon. So again, a reminder po, certificates will be handed and will be sent to your email inboxes only for those attendees who have spent at least 50% of the webinar duration, and they will also be given a link to the webinar presentations po. All webinar presentations and recordings of all of these webinars are archived and are also shown in the YouTube channel of TVUP. As if you go to tvup.edu.ph, you will see a link to our webinar recordings po. So with that, maraming salamat po. Please continue to join us as we try to wrap up season 1 of our UP PhilHealth webinar series. We are preparing for the next version of the series through a much more clinical perspective, and we hope you'd also continue to join us for those webinars. But at least for next week, we will have a very special guest that who will be talking about rehabilitation from COVID-19. So this will be very important for those yung pong ating mga recovered patients from COVID-19. So thank you so much. And with that, we will give you back at least 40 minutes of your time this Friday. Have a good weekend po, and stay safe, stay healthy, and stay connected. See you online.